Welcome back. Navigating health barriers can be difficult for the transgender and non-binary community in Canada. Accessing healthcare is a vital step in their medical journey.
So here with more information is registered nurse and case manager of trans and non-binary care at London Intercommunity Health Centre, Robyn Hodgson. Welcome to the show.
First of all, let me say, Robyn, it's an honor to have you on the show. Thank you for being here.
Oh, well, thank you for having me.
All right, so let's kick off this conversation. I want to know, what does the landscape of healthcare look like for transgender and non-binary people in Canada right now?
Well, we are still very much a medical model. Most people that are looking to medically transition, and we should say there's social and medical, but for medical reasons, you need to check in with a primary care provider, a doctor, or nurse practitioner.
Okay.
So how far do you think that we've come in when it comes to education and inclusion training for healthcare workers?
Yeah, for healthcare workers, if we go back about 20 years, the average doctor, nurse practitioners were just new at the time, would get about an hour in their core curriculum. Now, as it stands today, we're up to about 2 days, between a day and 2 days that is included in core curriculum. But for those folks that didn't have the benefit of having that in their primary education, they can get courses through organizations like Rainbow Health Ontario, Transcare BC, to become knowledgeable and provide this care in their offices.
Got it.
So when it comes to gender-affirming care, you say that most people start with hormone therapy. So let's talk about it in adults. So if you don't mind explaining to us what it is, how it works.
And that was part of our pre-interview. The majority of people that are seeking medical assistance are looking for hormones. There are some people that will just do a social transition and they don't need that. But the discussion about medical care comes from your primary care provider. Which can be a little difficult because some people aren't able to access a primary care, but 1 in 5 people in the community I reside in doesn't have a provider. But that is your door. They have an obligation to refer you to effective care. So that in some cases might be an endocrinologist. They may do the care right in their office, or it could be onto, in some cases, just directly to a surgeon.
All right.
Oh, wow.
So what does that access to therapy look like for adults?
So again, it's starting with a primary care provider or somebody that's knowledgeable in this care. As the healthcare landscape is changing, there's a virtual clinic that exists out there that somebody could just refer themselves to, but it's usually when it's only in the absence of having a primary care provider. Gotcha. It's also a paid service, so you have to have the economic capability in order to do that. Going to your family doctor, having a discussion. And so there's a set of guidelines out there here in Ontario. They're called the Sherburne Guidelines. Transcare BC has their own set. They guide us on what we have available. So the medications in Ontario are different than, or in BC, Canada in general, are different than the US or Europe. So you want something that's very much tailored to that group. And when we're dealing with health insurance plans, you may have to navigate what you can qualify for when medication is covered. So all of that goes on at the primary care level.
Okay, so let's talk about, we're talking about adults and options, and let's talk about gender-affirming care, like surgery. How is it covered at all under?
So most jurisdictions in Canada have some type of coverage, but it varies widely. And so anybody that is looking at wanting to advance to some type of surgical intervention should check with their provincial authority, or back to these primary care providers that we first talked about doing that. We do have to separate out, and there's a difference between surgeries that people may be considering that are considered medically necessary, and we separate it top and bottom. So it could be chest surgery, augmentation, or removal in some cases, or genital surgeries. The surgeries on the top side, there isn't, well, I shouldn't say isn't. If we're looking to develop something, we want to have a course of hormonal care that has started. But we do have a group of folks that identify as non-binary, and they may not need that hormonal component. And that is something in the province of Ontario and most provinces that is covered. The genital surgeries are quite a bit different. We need, in the guidelines that are produced by the World Professional Association of Transgender Health, recognize that in almost every case, we're going to remove some gonads. And when we do that, they produce hormones, and hormones not only give us the secondary sex characteristics, but also affect bone health. And in doing that, we need to know that somebody is going to be able to manage that hormonal therapy and that they're going to be stable on it.
All right, so for someone to be successful in their medical transition, we also have to talk about the journey from a social standpoint. So can you walk us through what that process looks like?
When we first started the conversation, I kind of leaned in. Some people may not actually seek out medical care. They may just change the clothing that they wear, their hairstyle. They may access different gendered spaces. And that may come in context with medical transition or without medical transition. Some of the things that we also have to consider, though, is what that means over the lifespan, because sometimes people are in relationships. And what does that mean coming out to a partner? What does it mean if you're have your own children and you need to accommodate that? We also need to consider documentation. If somebody's been working and has a career for 20 or 30 years, what happens if you want to go and get a new job and you need a reference, but you're using an affirmed name or gender marker?
Right.
So we do have to think some of those through. And that's where counseling can be intrinsic and making sure this is very successful for someone.
Yeah, there's a lot to think about for sure. How important is mental health in the trans community and that support?
So there's always a stigma around mental health. Historically, gender identity has sometimes been thought to be a mental health issue, and it is not. The World Health Organization, ICD, is actually moving gender identity into a sexuality as opposed to being categorized as a psychiatric disorder. So that's the first thing we have to think about. But when you think about the long-term physiological effects that are going on with someone's body, we're changing their work dynamic, their family dynamic, and sometimes there's a religious component, an ethnic component. We need to have a way that we support somebody as they do that, because it's multifactorial. Right now, there's usually a basic level, short term. You can access a counselor, usually a social worker, perhaps a psychotherapist, have some chat with them. We know within this population that there is a greater prevalence of both ADHD and autism spectrum disorder. There hasn't been a direct segue as to what causes that, except we are considering that in a lot of cases, this is probably them doing a greater self-evaluation. But when we're doing that and these are presenting them, we want to make sure that there's additional resources that look after the whole person as they start to do this.
Fantastic. Robyn, thank you so much for stopping by and informing us on this very important topic. Thank you so much. Honored to have you.
Hey there, what did you think? Drop your comments below and join the conversation. And don't forget to like and subscribe so you can find more on everything from food and fashion to pop culture and current events. See you soon.